A new partnership to help provide free care and medications to those who need it appears to be working. Liz Bonus joins us now with how it's transforming patients' lives. Liz.
Hey Rob, good evening. This partnership teams up with pharmacists at St. Vincent de Paul, providers at the Good Samaritan Free Health Center, and an organization which provides grants to help fund this program called BI3. If you're in need of medication and health care and you cannot afford it, this program could change your life.
Transforming Health, sponsored by BI3.
But I can remember being at work sweating a lot and urinating a lot. You know, I kept thinking something wrong. You know.
You'd never know it now, but several years ago when Tweety Frye was diagnosed with diabetes,
I couldn't afford the medication like I couldn't, and I had to make choices too. And sometimes I didn't even take the medicine. And then I didn't realize how sick I was without not taking it before I came here.
Here is the Good Samaritan Free Health Center in Price Hill. Thanks to funding for extra staff from BI3, Tweety can now meet with everyone from her social worker to her dietitian to her pharmacist, all in one visit.
This just brings everybody together, meets the patient where they're at. The patient has one place to go. They get all the information they need.
From there, however, Tweety is also invited to stop here at the St. Vincent de Paul Charitable Pharmacy in the West End. Their goal?
Having the medication for free available to people who really have no other choice. They have nothing else. They're choosing whether they're going to pay for groceries or pay for medicine.
And Jill Miller of BI3 says that's the point of this partnership.
If you don't recognize what barriers that these patients are facing, you might make the assumption that they're just being non-compliant. And that's not always the case.
With her no-cost care and her no-cost medication, Tweety now has her life and her health back in balance.
This is so God-sent.
The good news, she's not the only one. In the last 6 months, they've tracked diabetes patients served here and here at no charge. The results?
78% of these patients have experienced a reduction of hemoglobin A1C. They've experienced improved diabetes control.
Good for you. If you'd like to see if you qualify for this kind of free care and medication, we have a phone number for you. It's 513-246-6888. If you're a physician office or a nursing home and you can donate surplus or sample medications, St. Vincent de Paul asks for you to call them too. Rob?
Liz, thanks very much. This free care is not just for those with diabetes, but also other chronic illnesses that need long-term management.